Hello, everyone. I'm Associate Professor Chrissy Fedier of the Griffith University School of Medicine in the Gold Coast, Australia. I'm also the president and founder of the OCI Foundation, and I welcome you all to this short, but brief and insightful presentation. It's a health lecture on cervical cancers with a focus on the Our Youth Health Campaign, which is an initiative of the OCI Foundation for Nigerian youths against breast and cervical cancers. I said this series is on just cervical cancers. A bit of a scope of what we're going to cover today. It's going to be brief, but it's going to be very insightful and can be life-changing. We're going to do a bit of introduction, looking at cervical cancer statistics, basic facts and useful facts about the cancer, and then risk factors, signs and symptoms, and then we'll look at the solutions, which basically focuses on the role of the OCI Foundation. OCI stands for Nyobuchi Chrissy Federer Foundation, and its initiative called the Our Youth Health Campaign, otherwise known as the Arroy Health Campaign, as well as a mobile phone application called the OCI Survey Breast App. So quickly, let's go through this because we want to be brief and we want to make sure that we don't waste much time. Statistics in Nigeria, as of 2017, about 8,240 women out of 14,089 that had the cancer died. So that's a fairly high percentage. But then in 2018, the number went up 10,403 out of a similar number of 14,943 with the cancer died. So this is the second worst killer in Nigeria in terms of cancers. Well, if you're worried, it gets worse because projections have it that by 2025, deaths will rise by 63% in those under the age of 65 years and will rise by 50% in those over the age of 65. So there will be increases. And let's keep in mind that these statistics we are looking at are those who were recorded in hospitals. As you and I know, most Nigerians don't go to hospitals. They may go to prayer houses or to healing homes and stuff like that. So this is actually an underestimation. They are disturbing statistics, and we need to find an effective, affordable, and sustainable strategy to deal with these cancers. Unfortunately, a country like Nigeria has no government-funded preventive program. Well, a little more on the basics. Cervical cancer is a cancer that affects the cervix. So what's the cervix? This diagram here tells us a bit. All right, so we can see it's part of the female reproductive organ. It's also called the neck of the womb. So the womb is the uterus, which is here. All right, and you can see the vagina, which most of you can see. Then between the uterus and the vagina is the cervix. It's like the neck of the womb. It joins the uterus, which is this, where the baby grows, to the vagina. Just like a neck connects, the human body to the head. Okay, that's where this cancer grows. Some useful facts about this cancer. Nearly all cervical cancer cases are due to the human papillomavirus. It's a virus similar to the HIV, similar to the coronavirus. Different strains, but just a virus. Okay, it's called the human papillomavirus. It is transmitted sexually. Now, it's a known fact that those who, like in nuns, who technically should are supposed to be celibate, the rate of cervical cancers among them are very, very minimal, very small. Now, in addition to the fact that this is sexually transmissible, it's mainly from early intercourse, like those in their 16s, teens, those with multiple partners, those with unprotected intercourse. Okay. The good thing is that those who pick up this virus, not everyone develops the cancer. First of all, it takes between 10 to 20 years before it becomes full-blown cancer. And majority of the times, the body fights them off. So we have a good window of opportunity to deal with this cancer. And there are three ways to do that, three preventive strategies. Number one is through vaccinations. WHO recommends it for those between 9 to 13. And from my understanding, it costs between 10 to 18,000 per person per dose in Nigeria. And you have to get about 2 or 3 doses depending on the type you get. The second strategy, unfortunately in Nigeria, even though these vaccines are there, only about 2 to 6 out of every 100 women. So if you have 100 women in Nigeria, only between 2 to 6 of them will get this vaccine at the moment. A country like Sweden, about 90 out of every 100 women gets it. So it's a daring statistic that we need to all tackle. The second strategy is through cervical cancer screening. Now, it's recommended every 2 years. Unfortunately, many people in Nigeria cannot afford this, and we don't have an infrastructure that will help every woman have access to this. The third strategy is through creation of awareness, which is what we are doing now. Now, this strategy is affordable because it's free, it's effective, and unfortunately, campaigns on this have not been sustainable because the reach is quite limited and it's fairly expensive to conduct, which is why the OCI Foundation steps in with the ROI Health campaign that I talked about before. We're going to come to this later, but first, let's talk about important things about the cancer, the risk factors. So we've talked about the HPV. We also mentioned the fact that early age of intercourse, it's a predisposing factor. Not using condoms and having made multiple partners. These are all risk factors that increases your chances of picking up this cancer, the virus that leads to the cancer. Also, having many children, as you can see, anything that increases sexual activity, having many children, usually more than 4. Low immunity, like having HIV or other cancers, being on some kind of steroids and other medications that bring down your immunity. Other sexually transmitted diseases like gonorrhea, syphilis, and the rest of them. Poor diet, poor hygiene, because it weakens our immunity. Smoking also is a risk factor. And of course, lack of, cervical cancer screening, not doing your screenings. To catch up on this, download the Savvy Breast app. So you can easily do this now. We can pause this video and do it now. Just type Savvy Breast app on your Android phone or your iPhone. The Play Stores in those phones. Now, what are the signs and symptoms of this? I'm sure most of us already know about this, but ironically, majority of HPV infections do not show symptoms. So most of the times you wouldn't know you have this virus. And even when the cancer comes on, there are no symptoms. And most of these infections resolve on their own, like stated. But when they persist, they can, lead to cervical cancers. So the cervical cancer screening we talked about help detect these infections before they become cancerous. Unfortunately, even when they are full-blown cancers, there still may be no symptoms. So we need to keep this in mind and take screening very seriously because it picks them up very early. And by the time you notice the symptom, for those who have it, it's already too late. When symptoms do appear, there may be things like irregular bleeding or bleeding in between your periods. For those who have regular periods, all of a sudden becoming irregular can be a worrying sign. Bleeding after intercourse, take it seriously. Pain at the lower back or leg or pelvis, feeling tired, weight loss, but these are all, remember, in advanced cases. Odorous discharge and the rest of them, swollen legs on one side. Now, what are the solutions? How do we tackle this cancer? Which is what I believe everyone would want to be interested in knowing about. We've talked about the 3 strategies. They're all effective if you can afford them. Vaccinations, we talked about them, screening, and then preventive lifestyles, which is what this awareness is all about. Again, we talked about vaccination and screening not being very free and not being affordable in most countries like Nigeria. The costs are beyond the individuals, but early cancer has no symptoms. So most of the diagnoses come too late. Just repeating this for us, preventive lifestyle is the key. Take your screening seriously, get empowered now, and then, hopefully increase your chances of beating this cancer. It is free to, have this empowerment and it's of low cost. So where does the OCI Foundation come in? So we are an NGO, internationally registered in Nigeria and Australia. We take fight against breast and cervical cancers in Nigeria. We've been at the vanguard of this since 2017. We activities are based on promoting health, promoting education, and social and public welfare. But this topic is all about health. We promote the Our Youth Health campaign, which, through our app, you're going to get more information through the internet. Just to save time, we're not going to go into details. But again, download the mobile phone application called the OCI Savvy Breast. Pause this video and download it now. Follow the prompts. It's life-saving and it's free. So the Savvy Breast, designed to make this information available to everyone at your fingertip, both for breast cancer and for cervical cancer. It has a video on how to, for breast cancer, perform videos, perform the preventive strategies, techniques in examining your breast. It also is customized to send reminders to everyone, time to suit you, personalized for every woman. It is unique and the only one available of its kind in the world. It's free. Download it now. So just a bit of a video. This is what it looks like. You have the option to log in to your Facebook with your existing Google account or create a new one. This is what the interface looks like. You can see the reminders that reminds you when to screen yourself and check yourself. These are just the interfaces on what to do, and you can share this easily. So stay in touch with the OCI Foundation if you want to be part of what we are doing. We have presence on most social media, Facebook, Instagram, YouTube, Twitter, and the rest of them. So the links are here.